3M, more than Scotch tape, more than Post-it notes. Here at Africa Health, Mohammed's going to tell us a bit more about why 3M is so important in the medical field. Mohammed, Business Manager, 3M HIS, tell us a bit more about what you do.
Yeah, thank you very much and for the opportunity. So, as you said, 3M very well known for this brand, but however, in the HIS, it is first time for us on Africa, so I would like really to shed more light on that because people know 3M in general. So in the health information system, we are a global division. We have 4,000 expertise and talent in all kind of specialty in health economic, clinical team, physician, pharmacist, and documentation specialist. And we are having presence with the HIS division in more than 20 countries so far. And this is first time in South Africa, which very interest for us to come here.
Why is Africa Health important for you to be here?
Yeah, so we have heard a lot that Africa countries really having investment to improve care as majority of the world after the pandemic. And it's, I would say, at the right time to come partner with them in order really to support their journey to improve the quality of care and cost as well. And that's where we are here at this time, and we did not came before. So I think they are ready now for our solution and services.
So far, what have you thought of the exhibition? Have you had an opportunity to walk around at all?
Just in the morning, a few rounds. And we are really willing to meet the healthcare stakeholder, decision maker, healthcare provider, and distributor as well to tell them more about us and learn from them about their practice, what their main pain points, what the area that we can really help and support them with.
Every year, Africa Health sees incredible innovations, new technology coming to the show. What new technology have you brought to the show this year?
Amazing question. And I will try to simplify it on our journey to our customers. So in healthcare, the data accuracy is the key element for measuring the performance that the government needs to achieve. Our mission is to help improve this accuracy of data, starting by the physician, where when we have more demand for physician to document information about this patient visits, which is add more responsibility to him to be on administrator work rather than seeing the patient. Our main mission is really to simplify the physician work, to keep care of the patient, and then use our niche technology, which what we are presenting here, an AI speech recognition technology that have voice understanding, where we will help physicians to have a free hand, no need to type, waste a lot of time, just talk to the machine. You can voice enable the electronic medical record to just make orders, talk to the electronic medical record, and just tell the story about the patient, and the system capture it. And at the same time, we are not just understanding the speech, we understand also the medical clinical language behind it through our natural language processing or understanding. And the system will capture if there is a gap in documentation and nudge the physician just to correct it, so we have the right document at the point of care. So that's our one portfolio. The second one we are bringing here, which is in order to have the data actionable and have a meaning in analytics format, you need to transfer this text to a codes, where the statistical codes, either in international classification language, ICD, and procedure classification, lab code, etc., etc. So there is a department in the hospital behind the scene, take these texts and convert it to code. We bring two products. One is, if they are really digitized and using our AI and natural language understanding, we can take the medical term that the coder use to assign the code, and we can propose a code automatically. That's the AI. So the coders can no longer spend time reading the document and go through the coding rules, rather than just make sure the code we propose is accept with, and that increase their productivity by much. So instead, if you need 10 coders, maybe 5 is enough. That's the shortages in manpower. I speak about it, if you remember. And also, that technology improve the accuracy of data. So if the government mandate clinical language of care and introduce payment scheme maybe that need a DRG as part of the payment system, your accurate code is the source of that information. We have a technology to make them achieve that in a very simple way. If they are not digitized, we have also another technology where it helps them just overcome the clinical coding rules, where they manually put the medical terms, go through pathway, and we will have them the final codes and DRGs. So that's the two portfolio we bring here today to South Africa.
And that's just the tip of the iceberg. If you want to know more about 3M's technology and latest innovations, come down to Africa Health. It's free to enter, and we'll see you here.